Today we're talking tinnitus. Hi, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about anything and everything audiology.
And if you're not sure what audiology is, make sure to like and subscribe to our channel. Hit the little notifications bell so you can keep updated with all of our new content. We'll tell you all about it.
Okay, so today we're going to talk all about tinnitus.
Yep, it's tackling a big topic. In the United States, about 50 million people experience tinnitus in some way, shape, or form. So what is tinnitus?
What is tinnitus? Yeah, so some people refer to it as tinnitus. Tinnitus,
Yep.
You may have heard it called that. Either way is fine. Some people report that it's like a ringing, a buzzing, a hissing, a roaring. There's all kinds of different sounds, but basically what it is the perception of sound. So your brain is perceiving a sound that's actually not there externally.
Yeah, and oftentimes people will try to wear hearing protection or plug cotton in their ears or something like that to try to sleep. But really that doesn't do anything to help with the tinnitus. In fact, in many cases, it makes it worse because it's an internal perception. When you block out external noise, it actually makes you perceive it as louder.
Yeah, and tinnitus is really tough because, as we just said, there's no presence of external sound. So when you go and you tell your spouse or your primary care physician or your audiologist that you have tinnitus or ringing in the ears, and you describe to them what it sounds like, they're not able to hear that. So it's a really difficult issue to have, and it can really cause a lot of problems with concentration, for one. It can interfere with what you're hearing because of concentration and that perception of sound. And it can lead to things like anxiety and depression and just an overall stress because the sound can be present with you throughout most of your day, and it can be frightening for a lot of people.
Right, and oftentimes the relationship between stress and the tinnitus is what I kind of refer to as this vicious cycle. You know, our research continuously tells us that the more stress that's involved in that process, the more perceived tinnitus, and then vice versa. So it's just this ongoing cycle. But the number one thing that we hear our patients tell us that they've been told about their tinnitus is that they're going to have to learn to live with it because there's no cure.
Right, and that's a yes and a no kind of answer there. As of right now, no, there is not a pill you can take or a surgery that can be completed to just eliminate your tinnitus in most cases. So kind of, yes, there is no cure. But what we are here to say is you don't have to settle for that as the end-all answer. There are ways that it can be managed as a treatment option, and that's something that we want to touch on a little bit today. It's such a unique situation per patient that there's no way we could even begin to tell you what that means for you specifically. So as we always say, the first thing you want to do, mention it to your primary care physician, and then see an audiologist who is familiar with and specializes in tinnitus management.
That's right, and that's so important. Finding somebody that is really familiar with the research and really familiar with what's new and cutting edge, because it's continuously changing. The research that has gone into tinnitus, finding a cure for tinnitus management, things like that, is just this ongoing developmental process. And having somebody that's really familiar with that cannot be overstated. So if you are going to be referred a patient for tinnitus, what's your step one?
Step one is a hearing test. I think we have to have that. And then also a good case history, or just kind of an interview or consultation where we find out really what are you hearing? What are you perceiving? What sets it off? What makes it better, if anything? Those types of questions, just really getting to the bottom of the issue, and then doing a hearing test, because number one, we want to see in your auditory system, is there a hearing loss there? Because we do know that one of the number one causes of tinnitus can be damage to your auditory system, which could then show up as a hearing loss.
Right.
So that's why a lot of physicians, if you report tinnitus to them, they're going to send you right over, or they should send you right over for a hearing test, because it's a quick way to rule in or rule out if you do have issues with your hearing that could be maybe leading to that tinnitus.
Yep, definitely. And along with that hearing test, I know that we were talking earlier about how you can't really, your spouse or friends or your physician can't really take a look at that tinnitus and see it. It's not something that's tangible, but it is something that's measurable.
Right.
We oftentimes, in conjunction with that hearing test, will run a tinnitus assessment, and it gives us an opportunity to really find out more information about that tinnitus and take measurements so that we know a more accurate next step. All right, so we've got
That's
tinnitus. Yeah, that's me.
Oh, you do have tinnitus.
I do have tinnitus.
Yeah.
So I'm your patient. I have tinnitus. We've gone through the hearing test. I have hearing loss, which I do. So, what's my next step?
So it's unique for everyone, obviously, but once we get the hearing test, once we have all the information as to what it sounds like, what's setting it off, what's making it better, all that detail that we just talked about, once we have that, here at our office, what we want to do is put together a unique treatment plan for that patient. So if I put together a unique treatment plan for you, knowing that you have hearing loss, yes, part of this treatment is going to be to treat that hearing loss. We know from the research that is so important for the best outcomes that you can have. We were just talking about, following recommendations from any side of things. Like if you want to get healthier, you want to tone yourself, you want to exercise, but you're not willing to put in the work, you're not going to have the successful outcome that you want. And the same thing is goes for tinnitus.
I feel like you're talking to me.
No, I'm just saying.
No, it's true though. I mean, one of the examples that we just talked about was if you're wanting to get toned and lose weight, but you're not willing to change your diet, you're just willing to go out and take a walk around your house a couple times each morning, you're not going to have the same outcomes as if you were to follow a nutritional plan and go to the gym 3 or 4 times a week.
Yeah, and the same thing is with this tinnitus plan of action or plan of care that we want to put together. If you're not willing to treat all of those components and follow that plan, you may see some benefit. I'm not saying that you won't, but are you going to see the outcomes that you want? And you may not be as successful as you could be should you follow the treatment plan as a whole.
Yeah, and it goes back to what we talk about all the time, appropriate expectations. If you have the expectation that the plan's going to work really well and you're only willing to follow half of it, we need to either adjust your expectations or adjust your commitment.
Right. And kind of backpedaling a little bit, hearing loss there or not, there are other components to that treatment plan that do not involve hearing aids. So it's not all about just treating that hearing loss. There's a lot of things that we can do that we know about from the research that have been proven to help or lessen the perception of that tinnitus, or just help you to live a more relaxed, stress-free, like kind of bring down that anxiety surrounding that tinnitus. And that's really our goal, is to just help you live a better, happier, less stress kind of life with that.
Let's give them a roadmap. So we're going to start with just talking to a provider. If it's something that's bothering you, if it's something that's got you worried or is creating stress or anxiety, don't go to the internet first. Go to a healthcare provider and ask for a legitimate referral to somebody that you feel confident that knows what they're talking about. Somebody that's skilled in tinnitus management, and is up to date with the research. And if you're not sure, give them a call and ask, or check out their website. In that case, you can go to the internet. But once you have an opportunity to meet with that healthcare provider, follow those recommendations or get a second opinion about those recommendations if you're not fully committed to it. The point is you have to be committed. So I thought you would add something to that. I thought you would talk about the point that there is something that can be done, the overall lying message.
Oh yeah, that. Yeah. Okay, so the overall message that we have for you today is, do not settle for the answer of, oh, you just have to live with it, there's nothing you can do. Find someone who can help you, because there are options for management that can be used too. What are you laughing at?
Nothing, I'm not laughing.
The overall message we have for you today is that we don't want you to settle for the answer that nothing can be done or you just have to live with it. Make sure to talk to a trusted healthcare provider like your primary care physician and get a referral to an audiologist that specializes in tinnitus or is familiar with that. And I'm sure...
And commit. Why are you laughing at me?
Because you're laughing!
I'm not laughing at all. All right.
Okay, that's a wrap. We hope we gave you a lot of great information about tinnitus, what it is, where to find help. We just want you to know that if you do have tinnitus or know someone that does, there are resources for you. There's help out there, so don't settle for the fact that there's not a cure or you have to live with it. Do your homework, find a provider that you trust, and I'm sure that we or someone else can guide you through that journey to help with that tinnitus.
Yep. If you liked what you saw, please like and subscribe to our channel, or shoot us an email at info@hearwv.com. Give our office a call, 304-428-2403. Give us some ideas for new topics or questions that you might have. Other than that, till next time.
Thank you.
See ya.
There's going to be a lot of giggles in that one.